Information out to the public. So thank you for being here this afternoon, and we will go through our usual routine. I've got some updates for Medical Center and for Ector County. Then I'll turn it over to the doc and let him talk about Odessa Regional. He's got some good information too, and then we'll have a time for questions at the end. So with that, the health department, they did notify us earlier before this conference to update some numbers. And the most current numbers we have that at Ector County, there are now 22 positive COVID-19 that are being reported. So that's an increase. So 22 is the number, and that comes from the health department. They sent that over to us right before we got started today. So 22 positive COVID-19 in Ector County. As far as Medical Center, of course, we've had 7 positive. 4 of those are in-house. 3 of those are currently on the ventilator. We've had 47 negative tests. There's 21 tests pending. So that's those numbers are changing. So that seems to be moving in a good direction. We still currently have 13. They call labeled PUI persons under investigation. So we have 13 of those in house right now that we're. Those are, I'm sure, awaiting results to see if those are going to be positive or negative. But so in the House, there's 13 people currently under investigation. We're waiting on those to come back. So I just wanted to update you on a few other things. Just this is a little bit outside the COVID arena, but I think it's important because this has kind of affected the way our world is. We have our first Board of Directors meeting coming up since COVID has really taken hold, and that's going to be next Tuesday, of course. It's regularly scheduled. But we are going to do that through teleconference. So we're going to do that through a conference line, and that number is available, and we're going to have those agendas posted today. So on our website, those numbers will be available with the dial-in number and the code number to get in to listen to those. So, we're going to do all that board meeting by teleconference Tuesday. Okay, if you have any questions about that, let me know, but that should be posted up on our website with the agenda and the dial-in number and the code to get those to get on there to be able to listen to that. Let me just cover a little bit about our bed situation, just to recap how many beds and what the bed situation is. Of course, our ICU and our CCU beds, that count right now is 40. We have 40 of those available. On our 7th floor, which is kind of the floor we've created to make sure that we have a reverse air and everything, there's 28 beds there. So between the CCU and the ICU in the 7th floor, that's 68 beds total that we have. I know there was a study released by, I think it was University of Texas earlier this week, maybe today, and we did participate in that to get our numbers into there, but our ICU and CCU beds and the 7th floor, those numbers together are 68 total available beds. We have 42 ventilators available, so that's still good, holding steady. Those 4 we have in-house, 3 of those are currently on the ventilator right now. So, but we do have the vents ready to go. And I know there was another question that I got earlier today, but Medical Center is licensed for 402 beds. 402. We usually run around 220, 230 people in the hospital, so that's about our staffing level where we normally are, but we are licensed for 402 beds. Then you start taking the beds around us in the other buildings that we have here, that number goes higher than that, but our current license is for 402, and our operating, what we usually operate is about 200, 220 right in there. So that's some numbers. I didn't know if y'all are interested in that or not. Another thing I want to mention is we had a big conference call yesterday with, I think it was 15 regional hospitals around us. We've had conversations with our regional partners, but we wanted to make sure we kept those lines open just to kind of get a bed count of available beds around us. Also to kind of see what they're experiencing through their emergency departments and how their testing's going. Just if we see this big wave, we had conversations of, they're going to need to send their most critical COVID patients to us. We're ready for that. I know we're ready to assist our regional partners. And on the same hand with that, we discussed with them about us being able to ship non-COVID patients that are in the hospital that aren't ready to go home back to them. And most of them were in agreement with that. That will require some more discussion, but when we start talking about, we've seen some numbers, and I know the doc showed some numbers the other day where we're expecting sometime, this study said sometime in April, for this big influx of patients that if we get overwhelmed, we realize there's a lot of beds around us with qualified people in these other communities, and our partnership with them is very important. And they have people they need to take care of. There's going to be some that it's going to be more than what they can handle. They can send them to us. But at the same time, we'll have patients that they can handle. We need to be able to move those out so we can get more people in that are critical. So we thought that was good conversation, about 30 minutes long. We plan on having another one of those next Friday just to kind of update who is filling up, who's not filling up, and how their supplies and their ventilators situations are. But we had a very good conversation with our regional partners yesterday. So we were very pleased with that. So I've got a few other things, but I will let the doc talk, and then we'll take some questions. And I've got a few thank yous. We've had a few more donations. We'll go over that, but I'll turn it over to the doc.
Good afternoon, everybody. Okay, so numbers from Odessa Regional. We've sent 56 tests so far. The good news is that we have 36 of those back as negative. We have 9 of those back as positive, and only 11 pending tests. So we are getting those tests back now. I think I described to you guys before about tests that had to go far away to get done, and early on being late by about 2 weeks. Those are all back now, and those were negative, the early cases. So we have 9 positives, 36 negatives. In our hospital right now, we have 4 patients admitted related to this. 2 of them are persons under investigation, and 2 of them are the confirmed cases, the same 2 that are still in the ICU. And that's our overall numbers. They're still on ventilators. Okay, so the message for today, I think what I want to talk about is accountability, that we're going to talk about accountability of the public and accountability of the leadership, the medical leadership, the city leadership, all of those people. You have to keep us accountable as we have to keep you accountable. We're asking you for something, and that something is to actively do nothing, to stay home and stay safe. You're asking us to be prepared for what is to come. So we have done our best as hospitals and as leaders in the community to prepare, but we don't know when this is going to hit us fast and furious, right? So we're seeing this trickling in of cases. Okay, we have 20 cases, but you look at a place like New York and it has thousands of cases, right? But if you look at overall percentage of cases, you look at New York now, you think New York now, and you're thinking, oh my God, it's full of COVID. Well, the percent of the population that has COVID there is less than 1%, just based on the numbers itself, but that's what you see. So you know how hard it can hit, even if only less than 1% of the patients get COVID, right? So I guess what I'm trying to say now, for us to keep each other accountable for the long term, not knowing what this timeline is going to be. Is it going to be months before it hits us? We don't know. There's prediction models, and I shared that with you yesterday. But we have to be prepared for the long run, and that's why I called it a marathon. And I think we have to be on the sidelines for each other, encouraging each other on, handing each other the cups of encouragement and saying, let's keep going on this marathon. Let's stay home. Let's stay safe. And I think that's the big message for today. Thank you.
Russell, can you read the county numbers and MCH numbers again since we...
I will. Yeah, no problem. Let me just talk on what the doc said. Your analogy, this is not a sprint. It is a marathon. And unfortunately, right now, the finish line of the marathon seems very far away. I think that we all have to do our part, and you're right. What can you do is nothing, and that's very well put, because we do need people to stay at home, stay out of people's space, the 6 feet apart, wash their hands. We need that, and that is a big part. But back to your point we had a meeting this morning that this is not a sprint. This is not going to be over quickly. This is something that we need to buckle down, stay prepared, and be ready for in the long haul of this to make sure that we're all doing our part. And, piling into the grocery stores and into the home improvement stores is not doing your part. We completely understand people need supplies and things to live, and we want people to do that. But be smart when you do that and make sure that you're not piling in with 300 or 400 other people. So I appreciate your thoughts on that, Doc. You've hit it right on the head that this is something that we're going to have to grind through and hold the line and just make sure that we're all doing our parts. To repeat our numbers earlier, we did receive notice from the health department. Ector County is now reporting 22 positive COVID. That's up from yesterday. So 22 positives. At medical center, 7 positive. We've had 4 of those are in-house right now. 3 of those are on the ventilator right now. And also, we have 13 persons under investigation. Those are people who are watching closely. We've had 47 negatives and 21 pending. So, again, 22 positive in Ector County. At Medical Center, 7 were positive. 4 of those are in-house right now, 3 on the vents. So, before we get to some questions, let me say a few thank yous. I know we get questions all the time at both places. What can we do for the hospital? What can we do for the nurses and the doctors? And we've had some folks, and I certainly won't get them all today, but we'll continue to recognize folks that have gone above and beyond. The mask makers have been great. Dr. Armstrong, all the ladies and gentlemen and children around the Permian Basin that have made masks and are still making masks for all of us. Thank you for those. We appreciate those. Let me just run through this quick list if you'll give me a second. Of course, Legacy Nails and Spa for our mask. There's a welding company, Man on Fire Welding, brought a big trailer load of snacks, I think, to everybody in town, both hospitals. So Man on Fire Welding, thank you for that. Dr. Peter, he bought 240 helmets and face shields for staff. Hope City Impact and Hope Alive Church brought tons of snacks and waters for the nurses, and we're very thankful for that. Marquette's Cake Studio, a very generous donation of 250 cupcakes. I don't know how many of those are left, but there were 250 of those. And Airflow Filters brought us a big giant batch of air filtering material to help us make masks and things like that, and we're very appreciative of all those. And I know we have more, and if I left you out, I'm sorry. We will get those names out. But everybody who's donated, I had some questions this morning. What can we bring you? What do you need? And I know an easy answer for both of us is if you want to make a donation to, I think Stacy said the other day that she recommended the United Way. We have a foundation. Medical Center has a foundation. You can make a donation to there, and those funds go straight into the hospital or used for anything we could ever need. So the food and the snacks are appreciated. Donations through the foundation or to the United Way are much appreciated. So if anybody is wondering what they can do for either one of us, hopefully those are some avenues you can find to help us get through this time. So we do appreciate all that, and I know Odessa Regional does as well. So with that being said, take some questions.
If anyone has clothing to donate, can they donate the clothing that doesn't fit, or should they just go ahead and throw those away?
Like when you say clothing, like scrubs
shirts,
or?
No, I'm talking about like people that are saving up clothing to donate to charities and stuff like that.
I think that if you're donating clothes, first of all, what you need to do, you need to wash them first. Then I'd probably tell you to bag those in a bag and then turn those in to where you want to donate those and let them decide where those need to go. But I know even with the masks that we receive, these sewn masks that those are coming to us. They've washed them. Some have bleached them. They put them in individual baggies to make sure that they're not with anything else that can be exposed. So I'd say wash them first, get them nice and clean before you turn them over to anybody else. Yes, sir?
I just had a question. There was a doctor who was exposed to someone asymptomatic waiting test results. That doctor went ahead and delivered a baby. the next day before finding out that person had tested positive. The following day, that doctor had also tested positive. Just wondering if you could tell me what hospital that was at and if staff will be tested.
Well, let me tell you this. That provider, we want him to get better, okay? And I know the provider in question, I think we all do, and we know that this gentleman is a man of integrity and would not put a patient in harm's way. I can tell you, we have that under investigation, so here's the answer to that. I can't comment on things under investigation. At the same time, when all that's settled and done, and I know we've gotten calls, I know y'all probably gotten calls too, we've all received calls about it, and it's a very tricky situation with that. But I do know that when we talk about doctors, we hold those individuals in a higher regard. And like I said yesterday, these guys are going to get, and gals are going to get sick too. And I know anywhere in our building, and I'm sure in a regional building, when these guys come in, they go to patient care areas. Our policy through the CDC is that they gown up and mask up. So that way, even if they're negative or positive, they're gowned up and they're not exposing anybody. That's per the CDC guideline. And we've had that plan all along. We've stuck with that plan that when we have contacts with patients that our folks are gowned up, they're masked up to make sure that we're not passing it or nobody's passing it to us. So I'll tell you this, as more details become available, we'll pass those along, but today I really can't comment any further than that. Do you want to talk about that?
I don't specifically want to answer the question about a single doctor. I think there's plenty of information already out there and direct interview with the doctor that's out on the media that people can watch, so he can speak for himself. But what I can tell you is about CDC guidelines on who to test, right? So if there was someone that was exposed to someone that was known COVID positive or not yet known COVID positive and then turned COVID positive, there are specific criteria that public health officials follow to trace those people. And there is specific risk exposure levels. And I think I've mentioned this before, mild, medium, and high, or low, medium, and high per the CDC guidelines. So we risk stratify the people, decide which of those people is high risk, which of them need to be quarantined, which of them need to be tested, and then watch them for symptoms. So that's what would be happening at every hospital. The specific doctor you're asking about has not been in our hospital since the 19th of March, so that there is no risk of exposure to our staff or our babies. So I just wanted you to know that for us personally, it's not a risk right now, but for the doctor, he's already put out his public statement.
Okay, and if in general, if a doctor is exposed to someone asymptomatic who's awaiting test results, what should they do?
So if they're awaiting test results, means they're already labeled a person under investigation, right? A person under investigation is already on an isolated floor, is already wearing a mask. The healthcare worker that's entering that room is already in full PPE, the 4 pieces of PPE that I've talked about. So the chance of exposure, you're already minimizing as much as you can. Whether they turn out positive or negative, you're decreasing that chance of exposure. And everybody is monitoring for symptoms. So our hospital right now, everybody is encouraged to take their temperature twice a day and report to employee health about a list of symptoms that they could have. And if they become symptomatic, remember priority 1. So we would test them right away, send them home to isolate, and wait for the negative test result to come back before they'd be able to come back to work. So there's a lot of precautions in place to prevent any kind of exposure. Did I answer your question?
No. If say if a doctor was, in public,
Yes.
exposed to a friend or family member who said, I'm sick and I need to get tested, and they get tested, and that doctor knows they're exposed to someone, do they go to work the next day?
Yes, they do. They are asymptomatic and they wear a mask and they continue to go to work till they are confirmed exposure. And then depending on the interaction, how close were you, what kind of contact did you have, all that risk stratifies you, and then we decide based on those.
Just let me go a little bit further on that question. We both of us have strategies for in and out. So, for example, let's say we have a nurse that gets exposed, tests positive somewhere outside. They go through the process. We retest them 14 or 20 days later. They're ready. They're negative. They're ready to come back to work. We have processes in place to make sure, even though they have been through it, are negative, that they're protected themselves and the patient, like wearing masks, so we have I want to say an in and out strategy, before you go out if you're sick, and then before you can come back in when you're better. So those are out there, and honestly, those were pretty easy because the CDC lays that out very specifically on how to handle those folks, especially the healthcare workers.
Just for what's the morale of the ER, the ICU team? Can you talk a little bit about your team?
Absolutely. I mean, volumes have drastically dropped in our hospitals. Russell has told you that before as well. The morale of the doctors is great. They are prepared. They're happy that we have had this time without the big surge to be able to prepare. So everybody is ready, and everything is on the sidelines, ready to deploy and take care of the surge when the surge does occur. But like I said before, we don't know when that's going to occur. So now it's that waiting period. So there's this level of anxiety of, yes, the cases are trickling in, but when is this big thousands and thousands of cases going to happen? Is it going to happen? We don't know the answers to that question. And I think the doctors are in the same boat as you, as people, not knowing exactly what it's going to come, but well prepared for when it does come.
Are there any activities you do with them to build their confidence? Do you have people that come in and say, I may not be able to do this, but then you turn around and have a conversation and just...
It's an excellent question, and that goes for everybody, right? Not just the healthcare field, but definitely the healthcare field more because they're on the front lines. Yes, there is a lot we do with regard to drills. Yes, there is a lot we do with regard to providing support in getting them prepared and getting them to a mentally, to a mental ability to be able to put up with what they are going to go through. None of us have gone through it, so we're thinking about what it's going to be like. We're watching how it is for other people to go through in China, in Italy, now in New York, and trying to learn from them and prepare our people for the worst if it is to happen.
We have nearly about 30,000 viewers on our television program online. It skyrockets. Some of these folks say, I want to be interested in the medical field. How do they go about preparing themselves to study to be a nurse or a doctor? The interest, has it gone up?
Oh, I don't know if the interest has gone up. If you're telling me the interest has gone up, that's great. We definitely need more people that are interested in serving other people, and that's the reason you go into this field. Probably this is not the right place to talk about how to get into nursing school or medical school, but we appreciate the sentiment, and we echo the sentiment for any disaster when it happens. We all feel like, oh, we wish we could be there to do that, to help, and we really appreciate that sentiment. Yes?
Is there any type of debriefing, like at the end of the week with staff, to try to see, try to come together and try to come up with scenario, what you did for that week, how to make it better?
Yes. Yes, there is. So there is formal and informal debriefing, so it may be staff-specific, department-specific. There are drills, which is what I was mentioning earlier, to go through what would happen. Some of those drills are tabletop, where you just sit around and talk about a scenario and go through it with the leaders, and some of it is actually calling out the drill and walking through what it would be like if it happened. So yes, there is both of those things.
Do you think that because our numbers seem to be slow in coming, that it's giving the hospitals time to prepare?
Absolutely, it is. And I think without this time to prepare, we might have been caught in the same scenario that New York is now. But now that we do have time to prepare, I'd hope to say that we are starting to get more and more prepared and we can perform better.
At this time, are there any further developments from the vaccine from when you said that?
No, it's not going to be days before anything changes with regard to a cure or a vaccine. There's no way to predict exactly when a medication could come out or when a vaccine could come out, but we do have past experiences with other viruses. So if you look at it, that time frame could be anywhere about a year with several months on either side of it coming through. So there could be a medicine available or a vaccine available. Remember, we got introduced as a world, we got introduced to the virus in December of last year. So people have been working on it since then. So it's just a matter of time before the lab, some lab somewhere comes up with something that they can publicly announce and make available to everybody else.
So if there was a vaccine, would everyone be required to get it?
Depends on the type of vaccine, depends on the type of medication. So the CDC, again, would then look at what the case load is, who needs to get it, who doesn't need to get it, depending on how the vaccine works, which stratifications. So we talk about priorities for testing, right? So this would be a very similar answer to testing. They would prioritize, and they would say, okay, this group gets it now, this location gets it now, and we don't know exactly how that'll play out. So we have to wait to see when it does come out.
Guys, the conversation in the CBS 7 newsroom, at least, has gone in the last week from testing and numbers to, we're hearing from doctors and nurses now who say there's a PPE crisis in all 3 hospitals. And I don't think we hear it in these meetings, but I'm getting pictures of nurses and doctors in black hefty trash bags. I'm hearing from nurses that say, I have to wear my mask 4 days in a row, and it's really only meant for 1 day in a row. If these people get sick and they can't help, then we're in a bigger crisis. But is there an equipment crisis up there where they just don't have enough to wear right now?
So the answer to that, well, you said many things, but the answer to that is no, we're not in a crisis right now. I don't think we will get into that crisis unless we know when that surge happens, how fast and furiously it happens. Then we'll know whether or not we're in a crisis. We have a stockpile, a very healthy stockpile, and as I'm sure Medical Center does as well. So we are prepared for a surge. We just don't know how big that surge is going to be. We do have numbers on, okay, if it's this many, then we have it for this many weeks. And if it's this, it's for this many weeks. Nobody's walking around in trash bags here, not in the Permian Basin. Yes, those pictures are out there for people in New York, yes. Our staff being asked to wear the same mask multiple days in a row? Absolutely. That's what conserving PPE is all about. And those are CDC guidelines. So you wear the mask till it becomes torn, or till it becomes wet, or till you can't breathe through it, or it becomes soiled with something. And so those are actually regulations, and we're following them to conserve the PPE for when we might need it in the future.
That's a great question. We've seen pictures of people wearing Ziploc bags over their head for hairnets, and I think that we're not in a shortage mode. I think we're in a conserve mode. The CDC does the N95s without the soiled, can go 4 days. And I know our friends over at Texas Tech are working on a way to sterilize used masks to be able to make those go 20 days on top of that. So are there people wearing masks for more than 1 day? There is. Are there people wearing masks outside of the CDC guidelines? I'm sure in New York, and where our president said the national stockpile is depleted. We put in an order Monday for 50,000 N95s. And I hope we get those. I hope we get any amount of those. Everybody we know suddenly has become a mask salesman. I mean, I have mask salesmen calling me all the time. And even though you order these, we've seen some that have been en route to here that have been rerouted to a hot zone. And so what we're telling our folks, and I know the doc is telling theirs, is conserve those. We even have bags. They can put their mask in a bag, put their name on it, hold it there overnight. They come back, they can pick it up, put it back on. So, but I do think there are parts of the world that are being very creative with how and what they use as protective equipment. I just touched my face, sorry. All right, what else? Anybody got anything else? Doc, you have anything else? Let's talk about these meetings a little bit. I just want to make sure, this time we have, I just want to make sure we're using good use of people's time. We'll go ahead and let's keep the schedule for Monday, see what happens over the weekend, then we'll decide what to do with it as we go through the week, because I just want to be good use of everybody's time. I know from the question you asked earlier about the healthcare field, that even at our table at home, I've got a freshman and a sophomore, and we've had conversations about what does it mean to be a nurse and what does that take. And so I think it's good conversation, and I do think that it's nice that it's bringing a lot of interest into this, and hopefully it'll drive people into good career paths in the future. And so, but we want everybody to be safe. We want everybody, especially in the weekend. You know, people like to get out on the weekends. If you can park it at home, stay there. If you get out, keep the distance, wash your hands, stay out of large groups, and do your part. And let's hold this down. And let's get this thing over with. So we appreciate y'all's time. If there's not any more questions, Doc, I appreciate your time. Thanks for being here all week, and your crew. Y'all doing some amazing work. Our friends over in Midland, we wish them the best too. We know they're busting it over there too. So we want to send them our thoughts and prayers as well. And we hope y'all have a good weekend and be safe out there. Thank you.